Daniel Brox. I'm the Chief Medical Officer here at BostonSight and an ophthalmologist here. One of my favorite things is working with the patients on a daily basis and trying to understand what their goals are, what are the things they're missing that they want to get back to, and helping them reach those goals through the treatment that we provide them. And the second is to be able to work with people that all have that same mission and same goal. PROSE is important for patients with ocular surface disease because it provides them another avenue for taking care of their pain, discomfort, poor vision, and the health of their eye all in one setting. There's not many other or really any other treatments that can provide one option to address all of those issues. Oftentimes patients will come to us and be on many medications or have tried many medications or procedures, and we're able to really focus their treatment into one thing. I think it's important for patients to know about PROSE treatments, which may sound obvious, but more importantly and less obvious, it's important for doctors to know about PROSE treatment. Oftentimes that is not something they're aware of, and part of our mission is to educate our colleagues in medicine about the option of PROSE and when it's appropriate to utilize it. The types of doctors that would be referring patients to BostonSight would include optometrists and ophthalmologists, which are very typically what we see, but oftentimes now we're trying to ensure other doctors know about us as well. Rheumatologists, primary medical doctors, these types of doctors that deal with diseases that our patients suffer from need to know about BostonSight as well and what we do. So some of the conditions that people have when they come to see us really fall into two major categories. One is that they have a front of the eye, a cornea that's very irregular. That can be from different diseases, but also from trauma, injury, infections. It can be from genetic issues that they were born with or things that happen later in life as their eye changes. The other category of things are what we call ocular surface disease, and that is things like dry eye syndrome, some of the more specific types like Sjogren's syndrome, or some conditions that cause inflammation and breakdown of the surface of the eye, such as GVHD. So before using PROSE or being as familiar with PROSE as I am today, I would use, as ophthalmologists and optometrists very typically still use today, some more traditional measures such as lubricating drops for the patients with dry eye, or some medicated drops that can have some significant side effects for dry eye, as well as for patients with irregular corneas or poor vision. We would use some other more traditional types of contact lenses or try to do the best we could with glasses. But with the option for PROSE, in many of these cases, you're able to eliminate a lot of the other options they have to go through, focus their treatment to one possible treatment modality, or adjust what they're taking to make their life easier on a day-to-day basis. Collaborative patient care is always important to us. We can't do it alone. We work along with other optometrists and ophthalmologists that refer the patients to see us, as well as their primary medical doctor. When we see patients, we're always trying via phone calls or letters to collaborate with them to ensure we're treating the disease state in all the possible ways we can. Many of the diseases we deal with are not just affecting the eyes, but affecting the rest of the body as well. When I think of the patients that have particular impact, it's often our ocular GVHD patients or our Sjogren's patients. These patients very typically will have quite severe disease, be extremely sensitive to light, have very limited functionality from where they were before these diseases started to affect their eyes. It can affect their mood and their ability just to go about the things they enjoy doing. So you can very typically see a dramatic change even from the first time they put on a PROSE device in their affect and even smiling for the first time in quite some time, often in the exam room. So those are the cases that really stick in my mind and remind me of why it's so important what we do. So one of the things we discuss with doctors and ensure they understand, as well as patients, is the difference between commercial scleral lenses and a PROSE device. And really it has to do with two things: how complex the disease is, how much is going on, how much management will we need. Those fall into the category of more PROSE. And the severity of the disease, how extreme is it, how extreme is the irregularity of the cornea or the symptoms the patient has. The PROSE device provides us more opportunities for customizing the device in any way we really want. We have the engineering lab right down the hall, which we can discuss with at any time exactly any adjustments or changes we want that would be appropriate to each individual patient. What led me to get into this field from a private practice setting where I was treating general ophthalmology patients was really the needs of the patients. There was an unmet need to really focus on these patients, the types of diseases they're suffering from, and that I felt they could not get in the traditional medical setting. So working together with optometrists, ophthalmologists, and the medical community to provide these patients with what they need is something that I think needs a very specialized structure, which is something we have at BostonSight, where we're able to spend the needed amount of time with patients with complex ocular diseases.